We men, we just do not want to talk about that kind of thing. But once you do, you come out of there and you start talking a lot like me, because, you know, here I am at 67 years old, and you've given me another life.
I guess it's been how many years now? You came here around 2015? Then it's almost 10 years now.
Yeah.
So how have you been with the implant?
Well, pretty good, yeah. It's served me well, and really made my life better.
So you got how many times surgeries for the initial implant in the US, and the mechanical failure, you did get it again in the US, and then you came over here, I gave you a new one, and this is the fourth time, right?
Yeah, and I'm thankful every day I found you, because I mean, they were unable to control an infection that I developed. I think I actually carried with me from the beginning. You were able to work your magic and get me back on track.
Yeah, I mean, that was a pretty new kind of technique back then, because putting in the calcium sulfate, which is actually bone substitute, and we mix it with the antibiotics, and we put it in and maintained somewhat minimize the loss of the length. Yeah.
You kept me at least as long as I was.
It was about 6 weeks, and then we took it out and gave you a new implant. That's what happened. But yeah, this time, unfortunately, the mechanical failure happened, and I found out that the tubing between the cylinder and the pump had a really small leakage. So it was a very tiny hole. Because of that, it's like a tire flat, what happened. I was able to give you a longer cylinder this time. So 24 plus 1.5 centimeter, 25.5 centimeters.
Well,
pretty damn well.
My wife will be happy for that. But thank you you made it so easy. Your team at the hotel, jumping in a car, coming over here to the clinic, getting me into the room, everything went so quickly and efficiently, and your team is amazing. I mean, I can't say enough good stuff about it, and I know you're probably tired of hearing it, but I mean, this is the way I wish everything ran. You know, you are so efficient, and look at you. You are the world's best, and you can talk like a regular guy with me, you know. And how many people are you helping out there, you know, people that are afraid of actually bringing this up and talking about it. They don't even talk about it with their wives. I think there's a big drinking problem because of this situation. When you start losing your manhood, that's the important of your work. Your work is, I wish we could get it done robotically and you could actually go across internationally, because...
But like you said, you know, I think most of men or most of people, the problem is that they don't know that something like this even exists. So I always tell my people, or give a talk, I always tell them that we doctors are prosthetic surgeons, penile implant surgeons. We have a tunnel vision, because all we see is a patient who already knows about the penile implant. My friends knows about penile implant, but outside of that small circle, nobody knows about it. So I think that is the reason why things like this happen. So last year, 2024, in US, which is the biggest market of the penile implant in the world.
Really?
Yeah. So worldwide, around 50,000 cases are done yearly. It's not much, but
no.
Half of them are done in the US, 25,000. While breast implant were done 300,000 cases. So it's almost 12 times more than the penile implant.
If you compare the male and female, and losing a breast is similar to losing your ability to, and it's because people don't like to talk about it.
I totally agree with you.
And men are just, we just do not, want to talk about that kind of thing. But once you do, you come out of there and you start talking a lot like me, because it saved my life, you know.
Like you said, patient before the surgery, and when I see them again 6 months after the surgery, they kind of become a little different. The mood, the way they talk, the way they walk, everything becomes slightly different. And seems like most of them are very happier than before. So not just because of the having an intercourse, but almost in my eyes, they become a manly man again. Our genital function or sexual function is deeply rooted in our psychology, and you can't just ignore it. So when we get frustration with that, like you said, the study shows that men are having more tendency of the depression. They don't take care of themselves better, like drinking a lot, doesn't really exercise, and really don't want to meet people or friends even. So everything negatively affects us. So,
Well, those guys that you're talking about, that you notice a difference in them, they still probably have all the same problems that they had to begin with.
I agree.
But this gives them extra armor to face those problems. There you go. There's a good one.
Yeah.
Yeah, armor.
Mm.
It makes you feel more strong, so you can actually handle those things.
So you had this time the revision surgery for the mechanical failure. How was it? Was it more difficult than before, or was it smoother than before?
Oh, this was amazingly. I can't tell you. It's so simple, and I was thinking about this last night. Is the approach to pain totally different, nearly pain-free. I had some difficulty with, my back and the spinal anesthetic, but everything else is fine. And Kevin has been just amazing, and Ted, of course.
Well, I just had a chance to give a talk about the Center of Excellence for Penile Implant. I just did 2 days ago. It was a Cleveland Clinic virtual course, so they wanted me to talk about the Center of Excellence. So, Center of Excellence is not an award, but a concept that the medical professionals, provider, will focus on the certain item, so-called hyper-specializing it. And when they do, generally with the complex surgeries like heart valve or total knee joint replacement, penile implant, things like this, we are able to deliver a better surgical outcome in many ways. And I think it's the same with the patient management as well, outpatient or nurses as well. Because as you have seen, I am not the only one who is doing the surgery, and I am not always the point of contact with the patient. So that's why I wanted my nurses to be specialized as well. So Kevin is the guy who will always get your call on TED as well. So they have been dealing with this issue almost every day for the past 10 years. So it's the same job, same thing, same work every day, and we only do this. That's why
And yet
I think
you maintain your efficiency, and you're nice to the guys. You're nice to us. You're
well, thank you for saying that. To be honest with you, you're such an easy patient for me. Surgically, it's a little difficult.
Yeah, I was going to say that was. I thought mine was a pretty
complex case.
and yet you handled it like a.
Well, that's what I wanted to do, and that's where my kind of role lies in here. Because in the Asian continent, unfortunately, not many surgeons are trained properly. This got much less attention than they deserve in this area because of the cultural barriers, and
Yes.
people really don't want to talk about it. Probably because of that, surgeons are also didn't give much attention to it. I may be the first one who.
You're much more willing to get out there, and unfortunately, you have to spend a lot of your time getting out there and spreading the word. Whereas,
Well, it's a part of the job and part of the deal that I signed with, I guess, because if you apply the Center of Excellence to your practice, your center will end up serving as a training center, and you have to help the occasional implanters who have troubles, and you have to let the people know what will be better for their practice.
You know, the Center of Excellence is similar. I worked for a company for a long time, Motorola, and they were the original Six Sigma, the original Malcolm Baldrige Award, and everything was, you know, done professionally and right.
You said that meeting me was lucky, but I want to tell you that meeting you was lucky to me as well. Meeting a good patient is such a, you know, such a blessing and joy. When somebody like you shows up, I always feel really happy because, yes, surgically it's complex. However, that's my job. I do it every day. But aside from that, meeting a good person is always helps you a lot.
You guys do such a good job. I'm amazed that you can even, you know, in the States, a lot of the physicians, you know, they have the God complex, but you treat me just like a regular guy, and I appreciate that.
Well, we are just the same human being, and yes, like you said, surgeons are animals of ego. Otherwise, they can't really do the surgery because you have to open up somebody's body. But what I learned is that if something like that goes into your head, that really makes your life miserable because surgeons tend to think themselves as the world best or they are godlike creatures, but not really. We are just another human being. And there's a study shows that many surgeons, in fact, they retire early, they die early, they have a depression or drug abuse, things like that, because of the complication and because of the stress they get. And probably because they want you to be like a god, which we are not. I also had that kind of, you know, time with me as well, but giving it up, and you have to admit that you are not something supernatural. No, you have to be nice to people, other people, because that's the only way you will get your way.
Mine was a long one, wasn't it? It's normally
your case was because I had to do several, you know, fixations, and you had a distal impending erosion on the left side. And the reservoir placement was a little difficult and stuff like that.
That was a concern of mine, that erosion on the left side where it started.
Impending erosion, yes.
Yeah, thank goodness. Did you hide the diamonds in there?
No, I didn't. But what I did was a little different from the previous days, is that I kind of made a new tunnel with the remaining corpora, so corporal tissues. So the previous corporal tissues and the previous capsules will be shielding the cylinder from going the side. And the other thing is that your penis got longer than before. That is another reason why the cylinder tip was.
You'll have to talk to my wife, and maybe we can get some flyers made up as to how that happens to help your future patients.
I guess I think it means that you used it pretty well, and because of that, you know, the penis got longer, and then the cylinder was not able to stay in there. Probably the other fact is that you had a previous infection that may have weakened the corpora, especially distally. But now I think it's much better than before, the condition of it. So 90% of them stay that way. 10%, unfortunately, they will have the same, you know, this impending erosion. Then we may need some extra procedure, but it's only 10%. So I think you will be fine. But there's nothing like 100% in the medicine. So nobody can give you any assurance.
I wouldn't mind seeing you again in the future, but maybe to go out to eat or something.
Well, better not see me in the near future. So overall,
you know, I joke a lot.
Sure.
but
I like your joke.
I truly have developed a love for you because you've given me so much.
No.
You and your team have helped me so much. And I know it sounds like, what would it be called, hyperbole, or it's truth. And I just try. I'm a truthful guy, and you know, here I am at 67 years old. I'm 67, and you've given me another life.
You don't look like 67.
Oh, thank you.
So thank you so much for having a talk with me. So I wish you well, and
thank you,
have
Doc.
a safe flight back.
Thank you, Doc. And sorry if I come across a little crazy, but you know, you've done great stuff for me. Thank you.